Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer that I always go over and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. So if I am doing any videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get started. All right, before we start with number one for today, as you know, if you've been following and doing our videos each day, I have an upcoming practice question course on July the 13th from 10 a.m. to 11:30 a.m. Eastern Standard Time. It is $49. It will be virtually. You will get a few things from me. So I will walk through with this with you the exam breakdown for each of the exams that are presented by the ANCC and the AAMP. We will work through a few live practice questions just so you can gauge and see what I'm talking about. I'll give you the breakdown, you know, all the things practice question style so that you can gear your mind towards each exam and kind of get a handle on it. And you'll be able to work through the questions with me to make sure you're on track as well. I will also go through and teach you how to answer each question type, and then I will also provide test taking tips as well. You will get a copy of the breakdown of the information as well that I'm teaching from. Okay, so that will be sent out to you guys as well. So if you're looking to join, I'm doing a 20 student limit just so that I'm able to answer questions because I will be doing Q&A with this as well. And as we're doing the live questions so that I can give feedback to those of you who are participating. So if you're looking to join, get your spots. I see a few of you have registered. I can't wait to work with you and chat with you live um, in a couple of weeks. So if you're looking for it, the link is in the description and I'll also put it in the comments. Okay. All right, let's get into our questions, you guys. Question number one for today. A patient presents to the office with complaints of scrotal pain. Upon examination, print sign is positive. Based on these findings, what is the best diagnosis? Is it A, prostatitis, B, epididymitis, C, testicular torsion, or D, BPH? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first. Stem of the question here states, based on these findings, what is the best diagnosis? All right, so when we're looking for a diagnosis, what do I always tell y'all? You need to run it back and look and see what the assessment findings are. What are those subjective findings? What are they complaining about? How are they presenting, And what assessment findings have we found on exam? What are those objective findings, right? So this patient came in, they're complaining of scrotal pain. This should already alert to you at least two differential diagnoses that are associated with scrotal pain, right? Which is epididymitis and testicular torsion. Now, when we look at what the nurse practitioner has done on exam, the print sign is positive. This should now let you know that it is B, epididymitis, right? Because print sign is negative with testicular torsion, right? One thing, Brittany's brilliance, it just came to me to try to help you guys to retain epididymitis is when you are trying to differentiate between epididymitis and testicular torsion, um, remembering that the print sign is positive. So P for print sign, P for positive, epididymitis has a P in it, testicular torsion does not, right? So epididymitis is a positive print sign, testicular torsion is a negative print sign, okay? And then we can eliminate prostatitis and BPH because they're more so having those urgency, dribbling with urine, due to the enlarged, inflamed prostate. and not so much of the scrotal pain. Prostatitis, they may show some blood in the urine, things of that nature. But epididymitis and testicular torsion, when you think scrotal pain, those two should first come to mind. Next, you're going to want to do those Prinzine to as a rule out differentiator, and if positive, epididymitis. So again, answer here is B. All right, question number 2. The nurse practitioner and NP student are discussing the most common causes of epididymitis. What is the most appropriate response by the nurse practitioner? Is it A, a staph infection, B, an STI, C, muscle spasms, or D, trauma? Take a moment and tell me what you got in the comments. All right, so similar question here states, what is the most appropriate response by the nurse practitioner? All right, so what are we responding to? Nurse practitioner and NP student are discussing what are the most common causes of epididymitis. So what is the most common cause of epididymitis? Is it A, a staph infection? No, right? B, a STI? Yes. B is your answer. C, muscle spasm? Absolutely not. You can eliminate that. D, trauma. Trauma is a cause that can contribute to epididymitis, but one of the most common causes are STIs. You know, your gonorrhea, chlamydia can lead to epididymitis. Next, also like urinary tract infections going untreated, beginning to infect the epididymis can lead to epididymitis. Okay. So those are more your common causes. Trauma can lead to this, but top of the list, STIs. All right, and question number 3. The nurse practitioner has diagnosed the patient with epididymitis. What is the best treatment option? Is it A, amoxicillin, B, Cipro, C, Rocephin, or D, Bactrim? Take a moment and tell me what you got in the comments. All right, so stem of the question is the entire question, right? The nurse practitioner has diagnosed the patient with epididymitis. What is the best treatment option? Again, when I talk to you and say if the question and the ending is asking for a treatment, you need to run it back and see what the diagnosis is. Have they provided a diagnosis for us? Because if they have not, you got to run it back a step further and look for those assessment findings so that you can come up with a diagnosis, right? But here they have provided it, said the diagnosis is epididymitis. How do we treat epididymitis? Is it amoxicillin? No. Is it ciprofloxacin? No. Is it Rocephin? Yes. Think about the common cause of it. Gonorrhea, we treat with Rocephin, right? C, Rocephin is your best answer. You can also treat with doxycycline. Here, your best answer is C, Rocephin. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. I appreciate all of you guys and your feedback and your subscriptions and sharing with your classmates. I see it and I appreciate you. This helps get it out there and get it spread to other people as well. I'm just trying to show up to help you guys, and that helps me in my channel, so I appreciate you more than you know. And lastly, as I always say, if you need any assistance from me, please feel free to contact the nursing studio at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one at gmail.com. Things that I do offer. We have our review book, which you can get in the ebook option or the paperback option. There's a video in my shorts where I'm flipping through my review book if you're just looking for an idea of what it looks like and what you get. And it's the exact same thing on the ebook option versus the paperback. So if you're a tangible book holding person, that is an option for the paperback. And if you're just looking for the resource quickly, the ebook, once purchased, you'll have access immediately with all of the same things, and you can utilize it on any of your devices. Okay. Both of those are linked in the bio of this channel. My independent review, your self-paced review designed for family and adult Gero, are videos on each system, mini quizzes, images to go along with it, and you're able to watch it repetitively. Non-clinical content is included as well, and it's designed for ANCC as well as AAMP. It's also linked in the bio of this channel. My 5-week review course, we're currently in week 3 of 1, so be on the lookout on the next up and coming one. And then lastly, those one-on-one sessions. Y'all always ask about those and the tiers of things that I do for one-on-one. One-on-one, I have three tiers. One tier, if there's one or two weaknesses that you have, you can book sessions so that we can cover those to take that weakness and make it a strength. If you are wanting to have your exam readiness assessment completed, I work through that with you and give you feedback and give you a broken down idea of where you are with that to assess your exam readiness. Some people want to do that in a couple of factors. Some people want a long term one to see what they need to focus in on a little bit more. And some people who are testing soon just want to spend that time to just run through all systems with me for exam readiness. So those are the common ways that we do utilize those. And then lastly is that custom package. Custom package are just what it is. That's what the name says. It's customized based and tailored based on your needs. So say you've been unsuccessful, or say you're starting back your studying, or say you don't know where to start. This is how we utilize the custom plan. We first start with an initial pretest to assess where you really are. So I can gauge your weaknesses and your strengths. We design a study plan based on the amount of time that you want to review and study. We set this together. I work alongside with you, giving you assignments, and then meeting with you weekly along that time frame as well to study, and then making sure each week that we're building on those things so that you are not losing what we have already covered, and taking you from unsuccessful to successful. Okay. So if you need any of those things, feel free to give us a call. Again, with those one-on-one sessions, make sure you reach out to us so that I can gauge what you really need, and I just prefer to do it that way so that we can set up exactly what you need. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.